Good afternoon, and thank you for joining the American Association of Kidney Patients' 48th Annual National Patient Meeting titled Transforming American Kidney Health, Patients Take the Lead. I'm Ed Hickey, President of the AAKP and Chair of AAKP's Veterans Health Initiative. At a personal level, I'm also a fellow kidney patient and experienced care partner because of the history of kidney disease within my family. It's an honor to introduce our next session on patient insights and lived experiences, expanding impact within federal agencies. Kidney patients, as healthcare consumers and as a population that endures significant medical burdens, have gained support from a growing national and global alliance of research professionals, kidney medicine experts, elected and career government officials, and private industry executives and investors who share their desire to understand the various complexities of this condition and bring new prevention and treatment options to the market, as well as data on prevalence and trends. To achieve this commonly held goal, patient advocates have become more sophisticated in their tactics, and innovation and policy leaders have placed a higher priority on incorporating patient insight data, patient preferences, and real-world evidence. Nearly 10 years ago, AAKP founded its Center for Patient Research and Education and Center for Patient Engagement and Advocacy to serve as a rapid fulfillment hub for requests from kidney patient experts originating from government, academia, medical device manufacturers, and the pharmaceutical industry. Today, we are honored to have two federal agency representatives join us to speak to programs their respective agencies have stood up to not only track and prevent kidney disease in America, but also to connect patients with industry to address unmet patient needs and bring new devices to market that are truly informed by patients. First, I'd like to welcome Dr. Meda Pavkov, the lead epidemiology team in the surveillance, epidemiology, economics, and statistics branch at the Center for Disease Control and Prevention. We're pleased to have Dr. Pavkov join us to present on the CDC's new kidney disease surveillance program, a comprehensive information system for kidney disease that aims to reduce the burden and impact of kidney disease in the U.S. population. We are pleased to be among the first organizations to host a talk by Dr. Pavkov on this new initiative. Dr. Pavkov, I turn it over to you.
Hello, thank you for inviting me. Thank you, Ed, for inviting me to speak today about the CDC's Chronic Kidney Disease Initiative and the Kidney Disease Surveillance System. Chronic kidney disease is a public health priority. Health conditions that are regarded as public health priorities if they meet a number of criteria. They are perceived as a burden by and a public health threat by the public. They disproportionately affect minority and disenfranchised populations. And they are amenable to prevention by modifying socioeconomic and environmental factors. And chronic kidney disease mostly meets these criteria. And this is actually illustrated on this slide. More than 1 in 7 US adults, or about 36 million people, are estimated to have chronic kidney disease. This represents 14% of the adult population, a prevalence that is higher than that of diabetes. As many as 9 in 10 adults with CKD do not know they have the disease, and about 1 in 3 adults with severe chronic kidney disease are unaware of their disease. Further, when we break it down by certain demographic factors like age groups, sex, and race ethnicity, we can see that the prevalence of chronic kidney disease increases with age, is higher in women than men, and it's higher generally in non-white populations, particularly among non-Hispanic Blacks. The USRDS annual data report has shown that diabetes and high blood pressure remain the leading causes of end-stage kidney disease. Further, when we look at treatments for chronic kidney disease, we see that it's not optimal. This slide shows the prevalence of hypertensive treatments, including ACE inhibitors and ARBs, among US adults with chronic kidney disease and diabetes. We see that prescription for these medicines generally follow the prevalence of the disease. It's higher among those 45 and above, among women, and particularly among non-Hispanic Black people. However, considering that RAS treatment has been shown to slow progression of chronic kidney disease since the late 1980s and have been on the market for a long time, this prevalence of prescription is still suboptimal. Newer hypoglycemic medicines have been on the market for much shorter period of time. However, as we see here, less than 25% of those who need them, those with CKD and diabetes, have a prescription for these medicines. And this includes GLP-1 receptor agonists, SGLT2 inhibitors, and DPP-4 inhibitors. These are, again, data from the National Health and Nutrition Examination Surveys between 2017 and 2020. And this is remarkable because these are the only medicines that have been shown to not only reduce cardiovascular outcomes, but also kidney failure. So what is CDC CKD Initiative program? The CKD initiative is funded by Congress to conduct surveillance, epidemiology, and health outcomes research to raise awareness about the seriousness of chronic kidney disease and to raise awareness about the importance of early screening among people with high risk, those with diabetes, hypertension, or a family history of kidney failure. In addition to surveillance, epidemiology, and health outcomes research, we also conduct health economic studies, which help us understand and inform the public about the cost effectiveness of screening, treatments, and treatment targets as they are set forth by guidelines. For example, we have published in 2010 that screening for albuminuria among people with diabetes or hypertension and subsequent treatment with RAS inhibitors, it delays the progression to kidney failure in a cost-effective manner. We do our activity mainly in partnership with the University of Michigan, which is setting up the website for the kidney disease surveillance system. And its main task is to support and improve chronic kidney disease surveillance in the US. The larger purpose of the kidney disease surveillance is to maintain an ongoing comprehensive surveillance system on pre- and stage kidney disease in the United States, to document the burden of kidney disease, its risk factors and outcomes, to raise awareness of kidney disease and its risk factors, and help guide policymakers, providers, and other stakeholders to take action to prevent kidney disease. And we believe that the CKD initiative's tracking of the epidemiology of kidney disease at the population level is imperative so that public health professionals and communities can respond effectively to changes in the epidemiology and burden of kidney disease and to gaps in healthcare and quality of healthcare. This is the homepage of the kidney disease surveillance system on the CDC webpage. It covers current epidemiologic aspects such as prevalence, awareness, risk factors, outcomes, quality of care, and social determinants of health, as seen on the top tabs. Under each of these tabs, you find various current statistics. I will show some of these graphs that are on the website. For example, this shows kidney disease awareness among US adults with advanced CKD, so stages 3 and 4. As you can see, awareness has been slightly trending upwards over the years. However, the overall awareness, as shown by the dotted line, is still low, is somewhere below 20%. In terms of quality of care, these data show percentage of US veterans receiving albuminuria testing. Again, an upwards trend, but still insufficient. Less than 25% of US veterans receive an albuminuria test. And we know albuminuria in many cases is an early indicator of chronic kidney disease. This shows the prevalence of self-reported serious difficulties, cognitive and physical difficulties among US adults aged 65 years and older with and without chronic kidney disease. Difficulties, the prevalence of difficulties for hearing, seeing, concentrating, walking, dressing and bathing, doing errands alone, are much higher among those with and without CKD. We also will start showing more of the environmental factors on the kidney disease surveillance website. This here shows a map of the overlap between the distribution of poverty level and prevalence of diagnosed chronic kidney disease at the county level. These maps are very useful because they will help us define hotspots of overlapping environmental and kidney conditions. So moving forward, we will continue to strengthen visual tools and improve user experience on the Kidney Disease Surveillance System website, identify, develop, and disseminate educational tools and resources for people with kidney disease and those at risk for kidney disease, including materials that address the need for special populations. We will enhance surveillance activities to address the impact of social, economic, and environmental determinants on prevention and slowing progression of chronic kidney disease. We are seeking to include topics to educate patients with kidney disease. And ultimately, the goal is to improve CDC's public health leadership in maintaining kidney health, in primary prevention, awareness and education of chronic kidney disease through partnerships and effective public health approaches. Thank you again, AAKP and everybody for having me today, giving me the opportunity to present our work, and I hope that we will continue to collaborate more closely in the future. Thank you.
Thank you, Dr. Pavkov, for a great presentation on just one of the many projects the CDC is conducting on behalf of kidney patient population. AAKP is proud to partner with the CDC on this work, along with various other CDC initiatives such as Making Dialysis Safer Coalition and our ongoing role with the Healthcare Infection Control Practices Advisory Committee. I'd like to now welcome Ms. Tracy Gray, Patient Engagement Lead for the Center for Devices and Radiological Health at the U.S. Food and Drug Administration. The CDRH team has set the platinum standard for how federal agency offices can partner with the ultimate stakeholder, patients and citizens. CDRH, under the leadership of Dr. Jeff Shuren, has launched many initiatives aimed at incorporating patient insights including the Patient Engagement Advisory Committee. CDRH is recognized globally and nationally for including patients in the most respectful and substantive ways possible, and AAKP respects this office tremendously. Tracy joins us today to provide an overview of a new initiative launched by the FDA that AAKP is proud to be a part of, called the Total Product Lifecycle Advisory Program, or TAP. TAP is intended to help ensure that U.S. patients have access to high-quality, safe, effective, and innovative medical devices, first in the world for years to come, by promoting early, frequent, and strategic communications between the FDA and medical device sponsors. Tracy, this is an exciting program that the FDA is piloting, and I welcome you to share more about it with our audience.
Thank you, Ed, and thank you, AAKP. It's my pleasure to join you here at the AAKP Annual Patient Meeting. My name is Tracy Gray, and I'm the Patient Engagement Lead in the Center for Devices and Radiological Health, also known as CDRH. We are one of the centers in the U.S. Food and Drug Administration, commonly known as FDA. I'm part of the Patient Science and Engagement Program team in the Office of Strategic Partnerships and Technology Innovation. Our team is committed to engaging with patients as partners so that patients' perspectives are considered in the development and evaluation of medical devices. Today, I will share information with you that will answer these questions. Why engage patients in the regulatory environment? What is MDUFA 5? And how is CDRH's mission accomplished through MDUFA 5? What is CDRH doing towards MDUFA 5 patient engagement commitments? How do patients benefit from MDUFA 5? And what role can patients play in MDUFA 5 and in the future? CDRH's mission is to protect and promote the public health. We assure that patients and providers have timely and continued access to safe, effective, and high-quality medical devices and safe radiation-emitting products. We provide consumers, patients, their caregivers, and providers with understandable and accessible science-based information about the products we oversee. We facilitate medical device innovation by advancing regulatory science, providing industry with predictable, consistent, transparent, and efficient regulatory pathways, and assuring consumer confidence in devices marketed in the United States. Why are patients important to CDRH? At CDRH, patients are at the heart of all we do. Our vision is for patients in the United States to have access to high-quality, safe, and effective medical devices of public health importance, first in the world. In other words, we want our country to have effective and safe medical devices before anyone else in the world. At CDRH, we put patients first. This slide shows the different ways that patient input may be obtained. AAKP has been an integral part of patient engagement at CDRH. During my talk, I will share some new opportunities in which AAKP is involved. Patient input benefits all phases of what we call the device total product life cycle, starting with an idea for a new device that meets an unmet need, to the device design and/or aspects of a clinical study to evaluate the safety and effectiveness of the device. Patient input can also provide insights about a device that already exists on the market. For example, helping to identify potential safety concerns or opportunities for improvements. Patient engagement is increasingly being used throughout the device life cycle to inform healthcare stakeholders on a range of topics that are important to patients. Last January, FDA issued a guidance on patient engagement in the design and conduct of medical device clinical studies. This guidance helps companies understand how they can voluntarily use patient advisors to gain knowledge of patients' experiences, perspectives, and other relevant information about making the design and conduct of medical device clinical studies better. This guidance highlights the benefits of involving patient advisors early in the device development process. And it also shares which patient engagement activities are not considered by FDA to be research or an activity that must be regulated by FDA. FDA believes medical device clinical studies that are designed with input from patient advisors from different backgrounds, including those from racially and ethnically diverse populations, may help to address common challenges faced in these clinical studies and can result in benefits such as those outlined on this slide. For example, faster patient recruitment, greater commitment and study retention, fewer protocol changes, and outcomes that matter to patients. At CDRH, we engage patients in many ways. Through patient conversations that are only for CDRH staff, our device team gains a better understanding of patients' conditions and device experiences that are relevant to our regulatory work. Through public health symposia, the public benefits from patients participating on panel discussions focused on their condition and device experiences. CDRH also has a patient engagement advisory committee called PEAK, which is comprised of patients and caregivers. AAKP's very own Paul Conway has been chair for PEAK since 2017. PEAK, which occurs in a public forum, makes formal recommendations to CDRH on difficult matters related to medical devices and their regulation and use by patients. CDRH takes PEAK recommendations and acts upon them to advance our mission, and some PEAK topics have included augmented reality and virtual reality of medical devices, medical device recalls, artificial intelligence and machine learning in medical devices, patient engagement in medical device clinical trials, and most recently, advancing health equity in medical devices to support FDA CDRH's commitment that all patients have access to high-quality, safe, and effective medical devices. Under Paul's leadership of PEAK, patient input remained at the forefront of CDRH regulatory work. We appreciate and acknowledge Paul's hard work and commitment to PEAK as his tenure comes to an end in April of 2024. The CDRH Patient and Caregiver Connection includes organizations whose members have conditions that align with the focus of our device teams. The PCC, as I'll refer to it, is designed to broaden CDRH's staff's understanding of patients' experiences. Unlike the PEAK, the purpose of the PCC is not to provide policy advice, recommendations, or opinions, and no confidential information is shared. AAKP is one of our PCC partner organizations. Through this affiliation with CDRH, AAKP, and you, if you've participated as a member of AAKP, have provided valuable insights to our device teams about what it's like living with a medical condition and managing that condition with a medical device that we regulate. For example, during COVID-19, AAKP members completed a PCC survey that informed CDRH about members' experiences accessing renal device supplies. The renal device team considered this feedback as they developed strategies to address COVID-19 device and supply shortages. Recently, the AAKP agreed to provide patient input to medical device companies with breakthrough cardiovascular devices who are participating in a new CDRH program called the Total Product Lifecycle Advisory Program, which we refer to as TAP. I'll cover some more information about TAP later in my presentation. Now that you have an idea of why we engage patients in CDRH, let's talk more specifically about patient engagement within the context of MDUFA 5. But first, I'll provide a little more information about MDUFA 5. So what is MDUFA 5? As mentioned previously, MDUFA stands for Medical Device User Fee Amendments. Device user fees were first established in 2002 by the Medical Device User Fee and Modernization Act. Every 5 years since 2002, Congress has given FDA permission to collect fees from medical device companies for the purpose of helping FDA increase the efficiency of our regulatory processes with the goal of reducing the time it takes to bring safe and effective medical devices to the U.S. market. Last October 2022, Congress gave FDA approval to collect fees for another 5-year period starting October 1st, 2022, ending September 30th, 2027. These fees are collected when companies register their devices with the agency and when they submit an application or notification to market a new medical device in the United States and for certain types of submissions to the FDA. So how is CDRH's mission supported through MDUFA 5? As mentioned before, CDRH's mission is to protect and promote the public health. The MDUFA user fees support our mission by providing a way for us to hire, support, and maintain staff who review medical device applications. It also supports special programs, including the Patient Science and Engagement Program, which advances incorporation of the patient's voice throughout the device lifecycle. For example, the patient's voice was captured in a patient preference information survey about patient preferences for wearable kidney replacement therapy devices in comparison to in-center home dialysis-based devices on the potential benefits of the treatments and their potential risks of serious bleeding and serious infection. In another PPI study, a medical device company explored the benefit-risk trade-offs that some patients were willing to accept so they could do dialysis at home alone. This PPI study informed CDRH's decision to expand the labeled indications for the home dialysis device. Each MDUFA cycle, there are specific projects or commitments that must be met by the end of the 5-year MDUFA funding cycle. The current MDUFA 5 funding cycle projects are the result of discussions that FDA had with medical device companies, patient and caregiver organizations, and other members of the healthcare community who are impacted by work of the agency. While CDRH has many projects to complete under MDUFA 5, I'll focus on 2 that are related to patients and caregivers. Number 1, the FDA will establish the Total Product Lifecycle Advisory Program, and 2, FDA will help device companies work with patients in key areas by developing patient-friendly educational modules on topics that will help patients prepare for effective engagement with device companies. I've mentioned TAP a couple of times, so let's talk a little bit more about TAP. The goal of the TAP pilot is to show that the process improvements to FDA's early interactions with device companies and others who support the vision for TAP that can be done and can have benefit. The TAP pilot is designed for medical devices to have more quality discussions with FDA sooner than they were in the past about their plans for development and evaluation of a device, and before they request FDA approval to market their device in the U.S. The TAP pilot intends to help device companies understand what FDA expects when reviewing information about their device, consider ways to make sure the device remains safe and effective before and after it's been marketed, and last, understand the application submission process. The long-term vision for TAP is to help spur more rapid development and more rapid widespread patient access to safe, effective, high-quality medical devices of public health importance. In the future, TAP will also help ensure that the Breakthrough Devices Program, which is designed to provide for more effective treatment for diagnosis of life-threatening, debilitating diseases or conditions that are not reversible, remains successful. As part of the TAP pilot, device companies are encouraged to get early feedback from FDA and healthcare stakeholders like patients, insurance companies, and healthcare professionals. The device companies may have specific questions to ask stakeholders. Their responses help device companies make business decisions that may result in earlier device acceptance and access by the public. FDA helps connect device companies to stakeholders, but we do not lead the efforts after the connection has been made. We may attend the meetings as an observer if invited and if both parties agree. So why use TAP patient engagement? For the TAP pilot program, we're leveraging approximately 10 years of CDRH experience with purposeful engagement with patient and patient organizations to help device companies gain important insights that may help with device and clinical study designs and decisions about what evidence is needed about an innovative device to show that it's safe and effective and of benefit to patients. Patient engagement can help companies gain insights about patient engagement experiences throughout a medical device lifecycle. Here are some examples of patient engagement goals that TAP device companies may have. 1, understanding the intended patient's needs for a new device that's under consideration for development. 2, understanding which clinical study outcomes or endpoints are important to patients. Or 3, how to better design a clinical study so that it's easier for patients to participate, considering such things as how often patients need to be seen by the doctors conducting the study and what tests will be performed on them. Or last, number 4, how to make the information about the study that's given to patients when they're trying to decide whether to participate, which is called the informed consent process, more understandable. FDA's role to help device companies find a healthcare organization that will help them meet their patient engagement goals. The device company's role is to coordinate and meet with the health interest groups to get the input they need. Now let's talk a little bit about additional considerations for patient education. As previously mentioned, education for patients is being developed in response to our MEDUFA 5 commitment to help industry to work with patients in key areas by developing patient-friendly educational modules on items such as device trials, real-world data, device development tools, and regulatory frameworks. Some potential benefits of patient education include patients having access to training resources that will prepare them for engaging with device companies, patients being trained to provide input in all phases of a device life cycle, like before it goes to market, during the clinical study design phase, and after it's on the market when safety concerns may arise. Device companies having access to trained patients who can provide meaningful input about their condition and management with the device. And meaningful patient input ultimately advances U.S. public access to safer and more beneficial medical devices. Patients may benefit from MEDUFA 5 commitments by being prepared to meaningfully engage in the development and evaluation of medical devices and having access to safer and more beneficial devices sooner. Patients play an important role in MEDUFA 5 and in ongoing device regulatory efforts. Patients can seek opportunities to engage with FDA, medical device companies, and other healthcare stakeholders who are making decisions that impact how patients are diagnosed, monitored, and managed with medical devices. Seek opportunities to provide meaningful input about your medical device experience and what's important to you. Participate in medical device engagement opportunities through clinical trials, focus groups, surveys, and other opportunities that may allow your voice to be heard. Once available, you may complete the CDRH patient engagement educational modules that will help you better engage with healthcare's interest groups and provide feedback about how well patient education materials meet your training needs. Here are some links to CDRH patient science and engagement resources that may be helpful, as well as contact information to which you may send any patient-related questions. Thank you so much. I appreciate your opportunity and interest in CDRH patient engagement.
Thank you, Tracy. An excellent presentation and certainly a program that we hope expands throughout all divisions of the FDA. Having patients, the end user, and beneficiary of medical devices at the table from day one is so important to the development and success of any innovation. With that, I'd like to again thank both of our speakers.